fact, the Gaia Foundation wrote a long report about space health and sent it all to all the space agencies a few months ago now, where one of the factors in there are many factors in there, microgravity and ionizing radiation and all those things, but one was to do with non-ionizing radiation, i.e. the light environment. And of course, these guys are sitting in a tin can lit by white LEDs.
Yeah.
I mean, they changed the lighting in 2012. They changed it from a mixture between fluorescent tubes and I think tungsten filaments in 2012 to all LEDs. I mean, they introduced the circadian variation in color and brightness, but they're still all LEDs, and so they're completely infrared dark. So there's no infrared in the space station at all.
Wow.
And so they were living in a completely infrared starved environment for many months. And I think this happens in other infrared starved environments as well. And I'm sure if you looked at submariners, you'd find they came back sick. We don't know about this because we're not told, but I think these light starved environments, and the symptoms actually are very like scurvy. I mean, scurvy was the absence of vitamin C. What I call this 21st century scurvy, it has symptoms which are very similar to vitamin C. The symptoms develop over timescales of months and years, not immediately. But all the diseases of aging are determined essentially by the mitochondrial function. And when you destroy or slow the mitochondrial function, you increase the rate of aging and you reduce the metabolic efficiency of the life form. So, our view is that this is, there are many causes of obesity and type 2 diabetes, and junk food being not the least of them. But I think a primary cause of this is the light environment.
So basically what you're saying is a major contributor to mitochondrial dysfunction, which is going to underlie all kinds of things from metabolic diseases to aging itself, is an artificial light environment with a lot of emphasis on a lack of sufficient near-infrared light, which the whole planet is naturally enriched in, that we are now depriving ourselves of. And that's because this is giving us a less efficient energy metabolism.
Exactly. Yeah. Except I wouldn't say we're doing it just to exclude non-visible light. We're choosing this lighting for high efficiency, high energy efficiency to make visible light. And the point we've missed is that you need more than visible light to thrive. So you're saving energy, but developing huge health costs.
Right. Because people think, people are thinking of light only as visible light to see with, and therefore, if you have, an incandescent light bulb or something, it's going to drive up your costs because you're producing all of this quote unquote wasted light that we can't see. But in fact, it's not wasted light because it's being used for things besides vision.
Exactly. And I use them all the time. This is a 60-watt tungsten filament lamp run at slightly lower voltage. You don't need it to run at full voltage because you don't need to generate lots of visible light. I have LEDs on the other side to give me visible light. But this gives me healthy light. It gives me quite a lot of visible light as well. But it's so easy to do. But this is of enormous value.
You can run a light like that will give you that near-infrared light, and you can do it at a lower voltage.
Yes.
To save on your energy costs, but then still get that near-infrared light.
I can hold this.
I'm
holding this with my hand. You couldn't do that with a full voltage infrared lamp, tungsten filament lamp. So the point is, to get over the regulation. I mean, it's going to be illegal and it is illegal in the US to use tungsten filament light bulbs now, isn't it? It'll become doubly illegal next year when you have this new regulation, which requires a certain number of lumens per watt.
So you are using that light in your home. If you can't do that, would you just emphasize getting outdoors as much as possible?
Well, first of all, I would emphasize getting outdoors. I think getting outdoors is absolutely crucial. And what we're saying, and all the experiments we're doing with infrared light, is based on brightnesses that are not significantly more than the brightness you'd get at the sun from the sun at that wavelength. So the experiments we're doing, I think, are safe because we're not doing anything more than the sun would do.
Mm-hmm.
So we're not using lasers. I wouldn't ever use lasers for this kind of purpose because they can do all kinds of damage to do with their coherence rather than their wavelength.
Yeah. And so much of what we've talked about ties into mitochondrial health and metabolism. One of the things that struck me in the new paper that you wrote that I didn't know about before is that apparently the outer retina contains more mitochondria than any tissue in our body.
Yeah.
What can you start to tell us about the modern light environment and the health of our eyes, given how we've messed up our light environment, and now we're exposing our eyes to a very different pattern of wavelengths than we've adapted to as a species?
Well, first of all, I learned all this stuff from Glenn Jeffrey when I first worked with him, and I mean he coached me, and he said, in the cones in your eye, it takes huge amounts of energy to once you've detected a photon, in order to reload that cone cell, you need a very high input of energy. It's like loading a crossbow, okay?